Okay, I'll bring up our
Lovely.
screen.
I'll just introduce everyone. So the time is now 8:30, I believe, in Melbourne, Australia. We're very pleased today to invite pharmacy colleagues from Down Under to give us a brief overview of the Australian healthcare and climate impacts, embedding planetary health in health professions curricula and environmental sustainability in NHS versus Queensland Health. We have Catherine Forrester, who is a pharmacist and lecturer at Monash University, Dr. Judith Singleton, who is the senior lecturer at Queensland University of Technology and the lead for the Earth Research Group, Grace Wong, who is a Medicines Information Senior Pharmacist in Western Health Melbourne, the founder and lead organizer of Pharmacists for the Environmental Australia. And over to you, girls.
Well, thank you so much for having us. There we are.
Lovely. Yes, thank you so much, Mina. And hello, everyone. It's absolutely a pleasure to be here and to listen to such excellent speakers so far. I think we're all feeling a little overwhelmed by how far ahead of us you are in so many ways. But at least today we can feel good about saving around 15,000 kilograms of carbon emissions, I think, by being here on Zoom instead of flying. So before we start, I would like to acknowledge the traditional owners of the land I'm living and working on today, the Boonwurrung and neighbouring Wurundjeri people of the Kulin Nation, and to pay my respects to their elders past and present. And I would also like to acknowledge the traditional owners of the lands where others are joining us from today. So here's a brief outline of what we'll cover in our general update from Down Under today. So firstly, I'm delighted to introduce two pioneers of sustainability in pharmacy. So we have Dr. Jude Singleton, who, as Mina said, is a lecturer at Queensland University of Technology and a researcher in sustainability and pharmacy practice. And Grace Wong is a senior pharmacist at Western Health, a hospital network in Melbourne. And she's also the founder of Pharmacists for the Environment Australia. And I'm Catherine, and I'm a lecturer at Monash University. I have a background in hospital practice and HIV care, and sometime managing a very remote hospital pharmacy. So I'm not here as an expert in sustainability, but as someone who wants to learn more and to do better. And so it's been fantastic hearing from the speakers so far today about what is possible. So we're presenting a snapshot of what's happening in Australia. As we said, we feel we have catching up to do, but the momentum is building. So this green issue of Grit, which is a journal of the Society of Hospital Pharmacists of Australia, was published in 2019, and it showcased work being done by hospital pharmacists and technicians. And when we consider this topic, it's important for us to also acknowledge that First Nations people lived in this country sustainably for tens of thousands of years before colonisation, and Indigenous knowledge systems include complex understandings of the relationships between the environment and human health and well-being. So as non-Indigenous Australians, we have an unpaid debt and a responsibility to address inequities that already exist in current generations, while also making sure that what we do now upholds the rights of future generations. And as this quote says, we must invest in First Nations knowledge and leadership to better protect our land, water, country and communities. So I'll now hand over to Jude to talk about the climate crisis in Australia.
Okay. So I think we've already briefly covered the climate issues that we're already experiencing, but the direct effects of extreme weather events include trauma, burns, increased respiratory conditions due to airborne pollutants. And I'll make a little note here that bushfires contribute greatly to airborne pollutants and respiratory diseases in Australia and obviously everywhere else that has wildfires. And of course, you see death. Extreme weather events also disrupt health systems, and this causes in turn disruptions to major health systems and particularly in the aftermath of Hurricane Katrina, we saw that there was disruptions to maternal, antenatal and postnatal care and childcare, as well as chronic disease care. Indirect effects such as poor sanitation, contaminated water supply and malnutrition also negatively impact on chronic diseases and other diseases. And the sad thing is that climate change is believed to be increasing the health inequality gap and will have most devastating impact on nations that contributed least to its cause. For example, very close to us, the Pacific Island nations are already rising ocean levels are having severe impacts on them. So I just thought I'd put up this map to show you the rainfall in Australia. Australia was one of the first continents to start to feel the impacts of climate change. And despite that you might have seen us on the news as having lots of storms, etc., we're actually experiencing a multi-year drought. And as you can see, the dark red is very, very low rainfall levels. And the areas that are dark red are some of the most highly populated areas in Australia. So Australia's climate emergency, as I said earlier, our climate is warmer and drier, and the longer, higher and hotter and more intense heat waves, and of course the drier creates underbrush for bushfires. And so along with these heat waves and our droughts, we're seeing an increasing high risk of bushfires, and particularly in the southeast and southwest. So you will have seen some of our bushfire footage in the media. Now, what we have noticed in 2019, the bushfire season in southeast Australia, we saw firestorms, and the media called them gigafires of unprecedented magnitude, and firefighters, we had no way of fighting them. What's also concerning is that our bushfire season is lengthening. It's actually starting earlier, and we're starting to see bushfires in September, which is our spring. And this is a problem because also it affects our bushfire preparedness, because our bushfire season is now starting to overlap with the Northern Hemisphere bushfire season. And we lease firefighting aircraft, you know, the aircraft that bomb water on bushfires, we lease from Northern America and Canada. And of course, as our bushfire overlaps with theirs, we're not going to have access to those aircraft. Australia is also seeing an increased frequency and severity of extreme weather events. We're seeing tornadoes, hailstorms. The largest piece of hail ever recorded in white Australian history fell in Queensland this week. High winds, cyclones, and an event called the thunderstorm asthma. I haven't got time in this presentation to talk more about the unique thunderstorm asthma event, but there are publications available if you're not sure. Extreme weather has damaged more than half of Australia's marine ecosystems since 2011, and sadly, the Great Barrier Reef is endangered. And what was very frightening, I'm not sure if it was Tracy or Matthew's presentation, but an increase of 4 degrees. I put it up in the chat. The barrier reef will be gone if we have an increase by 2 degrees. So 4 degrees Celsius, the Great Barrier Reef will have disappeared. So what do Australians actually believe? Because as you're probably all well aware, certainly our government has been very slow to the table regarding climate change action. The Australian Institute 2020 poll of 1,998 participants found that 79% of participants agreed climate change is occurring, 82% were concerned that climate change will result in increasing number of bushfires. There was actually a huge amount of public rage when we had the 2019 gigafires and a lot in Twitter and other social media about the Australian government's failure to draw the link between our bushfires and climate change. 83% of the participants want Australia to phase out coal-fired power stations. 71% want Australia to be a global leader in finding solutions to climate change. And 68% believe Australia should have a national target for net zero emissions by 2050. So on the back of that report came the 2021 report, was only released a few days ago, the Medical Journal of Australia Lancet Countdown on Health and Climate Change. And the report was entitled Is Australia Increasingly Out on a Limb? So the key findings were that Australians are increasingly exposed to and vulnerable to excess heat. It is limiting our way of life. It increases the risk of heat stress during outdoor activities and decreases work productivity, as you can imagine, building, construction, all that sort of thing. So another thing that a lot of people fail to understand is that one of the big ways of reducing the carbon footprint, of course, is we look at travel. And I noticed in the chat that everyone was going, oh, you know, cycle, we should be using public transport. Now, I live in Queensland, and I was saying to Grace and Catherine earlier, Queensland, we have where I live in Brisbane, it's a semi-tropical climate, so it's quite humid. So we get the higher temperatures as do Sydney and Melbourne, not often as high as, say, Melbourne, but we also get humidity. So for us to walk home or cycle home when it's 37 degrees and 80% humidity isn't always possible. In order for us to reduce our carbon footprint of travel, our workplaces need to consider showering facilities. You can't walk to work or cycle to work in a Queensland climate without being able to have a shower before you start work. Oops, sorry, I've just bumped out. Sorry. So that's something that for Australia is a real issue, in that we, you know, the heat is actually going to impact how we can actually reduce the carbon footprint. And it becomes a cycle, of course. There's also an increase in extreme weather events, and this has got escalating social, economic and health impacts. Air conditioning your house for several months a year can be very expensive, and not everyone can afford to have air conditioning. And that, of course, causes heat stress and impacts chronic diseases. Climate change also is disproportionately threatening Indigenous Australians' health in multiple and complex ways. And the report also found that individuals, locals and state and territory, we're already doing very positive things, and Grace is going to provide a case study. There's been an increase in Australians uptaking solar rooftop panels, electric vehicles. Unfortunately, the federal government's policies and actions are out of step with the population. They're undermining positive action and increasingly place Australia out on a limb. So I'm now going to hand over to Grace, and Grace is going to briefly talk about Australia's healthcare system.
Thanks, Jude. So another warm welcome from Australia, the only island continent in the world. And I've put this infographic up on the screen here as I guess a reminder of the size of Australia. For me, the physical size actually really underpins a lot of the unique healthcare challenges that we face generally, and also specifically in regards to climate action. We are a relatively large land for a relatively small population. That dark purple spot is actually the UK on top of the map of Australia, and we have about 25.7 million people living in our last large land. That's about the third of the population in the UK. In terms of the unique healthcare challenges we face because of this, well, the geography and size, it provides challenges for accessing and providing healthcare. There is a disparity between health outcomes for people living remotely versus living in the city. And as Jude alluded to as well, the Indigenous Australians in comparison to the non-Indigenous Australians. We have over 200 different nationalities sharing this land. It's a very multicultural society with some very specific needs. And politically, our country is actually split up into states and territories. Now that becomes quite important because how our hospitals are run and funded and how different parts of the healthcare system are run and funded are managed by different, whether it's state or federal. So it puts an extra level of complexity there. Now I have put together a simplified diagram of Australia's health system. Oops, just move that back. It is in essence very similar to the NHS. We do have a private and public system. We do have subsidised healthcare and also pharmaceuticals through a scheme called Medicare, and also through the PBS, which stands for the Pharmaceutical Benefits Scheme, and that's available for all Australians. Now, our local hospital networks, I believe, are very much like the NHS trusts, so they contain the individual hospitals. And we have a federal government, so the national government, that funds hospitals based on their activity, the Medicare system and also the PBS, whereas the state governments, they actually provide the governance and run the hospitals. In terms of the carbon footprint of Australian healthcare, it's about 7% of Australia's total carbon footprint. Now, hospitals make up about 34% of that, and pharmaceuticals about 19%. I'm just switching the slide back. There we go. Now, a recent paper looking at Australia's largest healthcare system, so that's the New South Wales state, they actually also found a similar finding that pharmaceuticals were the second highest contributor to the overall carbon footprint of healthcare, as well as the second highest for water usage and production of waste after hospitals. So that's shown in the very small bar graphs, I know, which you can't read, but just to note, the second bar graph from the left is actually the proportion that pharmaceuticals contribute to the carbon footprint that's after hospitals. I have provided the original paper links there if anyone's interested to read further about those. I would now like to take you on a journey through my workplace, Western Health Pharmacy Department. So welcome to Western Health. Western Health is a local hospital network in Melbourne, in the southern part of Australia. It contains 3 acute hospitals and several satellite smaller hospitals and also rehab centres. We're about 25 kilometres from the city. And in our catchment area, we look after about 900,000 people who speak over 150 different languages. It is actually the fastest growing and most culturally diverse part of Melbourne. In the pharmacy department, we have about 150 staff working across the network. Now, in terms of our sustainability journey. Just checking my slides there. Yep. In terms of our sustainability journey, back in 2015, it was a fairly foreign concept in the Australian pharmacy world, I would say, just generally speaking. There was no mention of it in pharmacy departments. We didn't have mention of it by our pharmacy professional bodies either. And I had actually just started at Western Health at that time. And with me, I brought an environmental sustainability interest after I completed my master's in public health and also working overseas in India. and also in the remote regions of Australia. And coincidentally, Western Health at the time was starting a sustainability campaign that year. Their goal was to have what was called a sustainability action plan in every department of the hospital network to support the organisation to use resources responsibly. So it was one of those great blank slate moments. So I haven't left this slide blank unintentionally, because this is actually how it felt. Looking into no boundaries, limited only by perhaps money and imagination. I didn't have any resources to start with. There weren't that many people to really talk to in Australia either about this that I knew of. And it was actually around this time that I decided to start Pharmacists for the Environment Australia outside of work, and it really give me a forum to talk to like-minded people, not to feel as lonely perhaps as Jude alluded to right at the start. And I was also hoping to engage with other people that maybe I didn't know about, who was also working in pharmacy and interested in this space. So what resulted was we developed a sustainability action plan for our department. This is a roadmap for initially 5 years, and it was the intention for all the actions on this roadmap is to reduce the environmental footprint of the pharmacy services and to increase the accountability, I guess, and visibility. We did incorporate into our business plan as well, and initially supported by myself, being appointed the Green Champion, and then we also had some green representatives working at all the sites and supported by our organisation sustainability officer. In terms of the timeframes, I've put this here really to highlight that it's taken a bit of time for us to get going. We did hold some brainstorming sessions with our staff to explore what the baseline understanding was about environmental impact of pharmaceuticals, and also what ideas and actions were staff happy to commit to, and what were they interested in. Now, this has resulted in initially 21 items on our sustainability action plan. To date, that's grown to about 52 actions that we've committed to. Now, some of these include, new recycling streams, moving away from reliance on paper, being more vigilant with fridge monitoring, maximising video conferencing technology, as it's been highlighted today, quite a significant carbon reduction compared to travelling, eliminating once-use kitchenware and other things, window tinting, plumbed water. There was actually quite a large number of things, and they range from very small, simple actions to quite complex actions. I'm going to now run through some of the initiatives that are on our plan. One of the first areas we wanted to tackle was actually the tender process for the supply of pharmaceuticals into the hospital. To try and influence what and how medicines entered the hospital, we decided to embed pharmaceutical criteria into our supplier tender process. Now, in Australia, hospitals have a preferred supplier that they buy and also deliver their medicines to the hospital. And these suppliers actually compete every few years to get these hospital contracts. It's quite a lucrative process, because you can imagine there's quite a lot of money involved for the suppliers. And we were actually the first hospital in Australia to have such criteria relating to packaging, paper, reducing soft plastics, collecting pharmaceutical waste into our tender process. And at the moment, some of the things we are working on are converting to completely electronic for all paperwork, for example, invoices. We're continuing to work on reducing the soft plastic outer packaging that comes from them. Take back systems for eskies, ice bricks, anything that can be reused, and increasing recyclable packaging for what is entering the hospital. I also organised activities to engage staff And perhaps one slide is hard to describe how critical this was for the whole journey, in that quiz days, green awards, newsletters, guest speakers, Q&A sessions really helped understand, I guess, what people really wanted. What did my colleagues want? What did they understand? What were some of the barriers perhaps to engaging? And over time, over the last 6 years, I really have noticed more acceptance and a lot of enthusiastic adopters of the Green Way. And it really is about a tipping point, finding that sweet spot where things start to just roll forward. And I believe we've recently reached that point. So it's quite an exciting time. We also wanted to know how we were managing recycling. And so we did a rubbish bin audit to find out what's going on in our rubbish bins. Now, our audit found that 60% of our total rubbish was being put into recycling streams. What we wanted to do was increase this to at least 80%. And we decided to target items that we found in high volume in the landfill or the rubbish bins. For example, polystyrene, ice bricks, used syringes without the sharps bit, paper, soft plastics. And so we wanted to look more deeply into these types of materials to see what else could be done with either returning, changing to another resource to use, or if we had to use it, what recycling options were there. Now, polystyrene, we are working with the supplier to reduce it, first of all, coming in. It continues to come in intermittently. It's very hard, seems to stop from all suppliers. What does come in now, we do send for recycling. We again, the first hospital in Victoria to set up a polystyrene recycling system, and from the pharmacy department, it's now rolled out to the whole hospital. They're sent to make waffle pods at the moment for construction. That's where our recycling company sends it to. We've also managed to secure a local recycler. Now, this is quite not a mean feat, because in Australia, a lot of our recycling actually is shipped off overseas. And this is something that we really wanted to avoid. We wanted to continue that circular economy within our state. And actually, it's quite local. It's only down the road. We were quite fortunate about that. Another target area were the syringes. And in terms of syringe recycling, we were targeting syringes that hadn't been in contact with cytotoxics or medications. So they're the ones that have only been in contact with saline, water for injection. And we are now donating those to local animal shelters, which became quite important, particularly during the bushfires. And we are also sending them off to be remodeled, or I should say remolded, I think is the word, for other purposes. And some examples are on screen there. They're made into cutlery for people with physical impairments after strokes, and they're quite artistic looking. In fact, they were shown at the art gallery in Melbourne when they first came out. So quite beautiful, as well as quite user-friendly. Now, sterile room garments, I'm not sure if you guys call it sterile room or aseptic suite, but our aseptic suite produce a very high volume of waste in our department. That's what we found through the rubbish bin audit. So we decided to also target this area, particularly the single-use items. And we wanted to look at the sterile room gowns and how feasible it was to switch back to reusable. A lot of things have gone single-use in the hospital. But when we look more closely at things, the cost difference between going back to reusable and, of course, the impact on the environment is actually, well, the impact is quite significant, but the cost difference in terms of the garments was found to be actually very minimal. And in fact, we had positive feedback from the staff saying that the reusable options were actually more comfortable, breathable. And so it was fortunately quite a win-win situation for our switch back to reusable. And look, this question has come up right now because also of COVID, where we've gone single-use everything. there are clinicians in our hospital now really reflecting on how can we in the long term sustain this and go back to perhaps looking at some of the reusable options. So this is one example of that. Now, anaesthetic gases have been really thoroughly covered by our previous speaker, so I won't speak too much on this, in that we do have a campaign at our hospital. It's really focused on the fluorine gases. We do have a separate project looking at nitrous. It's a very big project, as it was highlighted in our previous talk. But in terms of fluorine gases, we have switched actually to sevoflurane. It was a collaboration with our anaesthetists, with our theatres pharmacists. So that's a whirlwind tour of my hospital. I just wanted to finish with a quote. I love quotes because it really reminds me of what it's all about. And I guess beginning on this environmental journey, I didn't really know what to expect, what to do, and perhaps where to turn. But what I've come to know is that nothing is ever too small to know. It always comes in handy. And nothing is ever too big to attempt. We just have to break it into little pieces and it becomes possible. So thank you. I'm going to now pass it to Jude. Just one second. Thank you, Jude.
Thank you very much, Grace. So I just want to briefly talk about an initiative that a global group of health professionals undertook, and it was the AME consensus statement. AME is the Association for Medical Education in Europe, and we are a global group of academics from around the world, that predominantly medical academics, but there was a very small group of us who are educators for the allied health professions and nursing, and I was the pharmacy educator that was invited to join this team. And we created this consensus statement that it's really a blueprint it's an acknowledgement that there is a climate crisis and that health professionals really have an obligation to do something. And its purpose was to create a vision for educating an interprofessional healthcare workforce to deliver sustainable healthcare and promote planetary health. And the great thing about it is, for those of you who would like a resource to go to, if you're also wanting to run a course or training, it's etc. This consensus statement also includes learning objectives, knowledge requirements, and the professional values. So it's a really, really lovely blueprint for anyone across the world who would like to include sustainability in a degree or a training program. It's also intended to inform national and global accreditation standards. So we can only hope that sustainability will be included in accreditation standards soon, certainly not our part of the world. So I'm now going to hand over to Catherine. Thanks, Catherine.
Apologies, unmuted myself. So thank you, Jude. I'll quickly run through one example of how sustainability can be incorporated into a pharmacy curriculum. So I was lucky enough to join the Monash pharmacy course team when we were undergoing a curriculum transformation. So there was an opportunity to think big about what to include, and I was involved in planning content for the first iteration of the 4th year of the course to be taught in 2020. And so we identified that the environmental impact of healthcare was an important issue for future pharmacists to be equipped to tackle, but also that this was a topic that would allow students to explore uncertainty, to use systems thinking, and to develop their teamwork and problem-solving skills, which are transferable. And so our accreditation standards were then updated in 2020, and although they don't explicitly mention sustainability, they do have a strong emphasis on social accountability, and so we included related learning outcomes and related that to sustainability. We also introduced students to the FIP Statement of Policy on Environmentally Sustainable Pharmacy Practice. And we showed them short videos recorded by pharmacists, including Grace, so they could see some real life examples of sustainability initiatives. So to help students explore the interplay between quality use of medicines, environmental stewardship and patient-centred care, we use a case study of a patient who was worried about her asthma inhaler contributing to climate change. And they explored that in an interactive lecture and workshop. And then they also, in an assignment, were asked to consider sustainability as part of a quality improvement proposal. And so very quickly, these are just some interesting points from some very quick polls conducted in one of our classes, so not scientific, but students agreed that promoting QUM, quality use of medicines principles, is part of environmental stewardship, but 91% thought that pharmacists should also take further action to reduce the environmental impacts of healthcare. And these two on the right were interesting. They seem to show a disconnect. So while 95% of students agreed that climate change is relevant to health, only 78% agreed that climate change is relevant to pharmacy and pharmacists. So that's something that we'd really like to explore further in the future. So looking ahead, we're now using that AME consensus statement that was published earlier this year, as Jude mentioned, as a guide to how we can integrate these principles across the curriculum, across all health professions. And there's currently a research group in our Faculty of Medicine, Nursing and Health Sciences looking at this. And this challenge clearly needs us all to collaborate across and outside disciplines. It's beyond something that pharmacy alone can tackle. But at the same time, there are also some actions clearly that we can specifically take within our profession, as we've seen today. And notably this year, FIP has included sustainability in pharmacy as one of its development goals. And because this also overlaps with other key roles of pharmacists like antimicrobial stewardship, deprescribing and optimising medication therapy, embedding sustainability in the curriculum can start by explicitly highlighting the environmental benefits of those roles. And because it's really important to give students hope and to empower them to see the actions that they can already take, I think that that's a really good way to go as well. And finally, I just wanted to acknowledge that I was reading and learning about this topic while I prepared and taught it for the first time, and I couldn't have done that alone. I had really great support from our Director of Pharmacy Education at Monash, but I also, through this work, found a network of supportive pharmacists, including Grace and Jude, who I was able to learn from and with. And I was also lucky to meet some passionate pharmacy educators and students in the US. And one of the actions that helped to mitigate my anxiety during 2020 in particular was in writing a call for collaborative action with those pharmacists and creating this online space. The idea is to help pharmacists around the world to connect and to amplify and collate work that's already happening. So there are links to resources, forums, and it also aims to help pharmacists find local or national groups like Pharmacy Declares and Pharmacists for the Environment Australia. So if you're interested, please have a look and join. So now I will, hand over to Jude.
Thanks very much, Catherine. So I was a little bit like Grace and Catherine when I introduced sustainability into the curriculum in QUT. Was when I first started to think about it, 2015. I knew that some pharmacy schools in the UK and Finland had up and going sustainability clearly embedded in their curricula. But I sort of did it by stealth. No one was particularly interested in the academic team initially in adding sustainability to the curricula. So I just did it. And Australian and New Zealand accreditation standards don't mention sustainability. So we posited our sustainability content under social accountability, the same as Catherine did at Monash. And so really sustainability content in the pharmacy curricula and in my department was driven by green champions. So me, and then I had a green course coordinator and a pharmacy discipline lead who didn't mind me adding it. So I first introduced them into 2016, and I introduced it just into second year into the quality use of medicines unit because I could see a relevance there. So the quality use of medicines is actually one of the key objectives of Australia's national medicine policy, and it's all about the rational use of medicines. And so you can see the clear connection to sustainability, where, you know, sustainability is the rational use of finite resources. So I thought that was a really logical place to start, and students really embraced it. Australian, or certainly Queensland students, do cover some sustainability in their primary school and high schooling. And so I found the students were reasonably knowledgeable. So what we have now, we have one 4-hour workshop in the second years in the quality use of medicines unit. So I revamped the content this year to follow the AMI consensus statement recommendations. So the learning outcomes were based on that. There's been for several years also a 4-hour fourth year workshop in the business management unit, which I coordinate. And this is really about applying sustainability practices to pharmacy practice, predominantly community pharmacy practice, but also hospital pharmacy practice. And there is a major assessment item in fourth year on sustainability. So there's also a sustainability station in each of our year levels OSCEs now. In 2020, QUT helped my cause by announcing a strategy to exceed the Paris Agreement emissions targets, and QUT aims to not only meet but significantly exceed the reduction targets outlined by 2030. They're hoping to be net zero by 2040. So I've just screenshotted just our QUT's website. They've also appointed a Deputy Vice-Chancellor Sustainability, and her role is to get us to those net emission reduction targets. So very exciting. And you can see that as part of our QUT's vision is to embed sustainability into our curriculum across all of the programs. And my role will be in the Faculty of Health to oversee embedding sustainability into all of the degree programs across all the professions in the faculty. And so I now, lastly, I just wanted to present some of my research, which was actually looking at whether or not hospital pharmacists were engaged with pro-environmental behaviours in their hospital pharmacy workplaces. So this was actually my PhD study, and it was mixed methods, and I was looking at variables that were antecedents of pro-environmental behaviours. So I selected, and I won't go into great detail, but I selected 3 key variables: environmental attitude, level of environmental concern, and environmental knowledge. And I also picked a 4th variable called organisational factors, and that might prove to be barriers to pro-environmental behaviours. And with this, I decided I had to pick a pro-environmental behaviour that I could measure. And so I selected disposal of pharmaceutical waste. Now, pharmaceutical waste comprises the active pharmaceutical ingredient, but also the original container and any packaging that might come with it, say plastic spoon or a syringe or whatever. Now, I was very confident that apart from the fact that hospital pharmaceutical waste is audited, so I was very confident that everywhere I went, and I did conduct bin audits, that pharmaceutical waste would be appropriate, so unwanted pharmaceuticals would be appropriately disposed of in clinical waste bins, and that was clearly the case. But what was very interesting was what was happening with the disposal of the packaging waste. So my participants were in Australia. They were in Queensland hospitals, in both metropolitan and regional hospitals. I had 41 pharmacists and 25 pharmacy technicians. In the UK, I visited 4 NHS trusts and 6 hospitals, and I had 23 pharmacist participants and 17 pharmacy technicians. So my data collection process comprised, first of all, I got participants to complete the new ecological paradigm questionnaire. So this is a 15-point questionnaire, and it dates back to, it was developed in 1978 by Dunlap and Van Lier, and it is a highly regarded questionnaire for determining someone's environmental attitude. So that's the scoring there, from anti up to pro-environmental. Once the participant completed the questionnaire, I then conducted a semi-structured interview, and I was asking questions around the other variables, environmental knowledge around the impact of pharmaceuticals on the environment, how concerned they were about this impact, and then were there any organisational factors such as infrastructure that might be a barrier to them disposing of pharmaceutical waste appropriately. My data was both quant and qual. My quantitative data, I conducted statistical testing. My qualitative data, I coded manually, and I also analysed it using the text analytics tool Leximancer. So my results. Interestingly, there was no statistically significant difference between Australian and UK pharmacists and technicians across those 3 variables. I did expect a difference because by that stage, I collected my data in 2016, and the NHS had had the Sustainable Development Unit established since 2008. So already a lot of work had been done. Also, the UK had legislation around carbon reduction targets that the NHS had to meet. So I thought that I would see a lot more environmental behaviours, or perhaps, or rather higher environmental attitude and perhaps higher environmental knowledge and concern. And I did not see that, which was quite interesting. More Australians than British expressed concern for the environment. In Australia, there was a statistically significant difference in the mean NEP scores between concerned participants and participants who weren't concerned, but I didn't see that in the UK cohort. The mean NEP score was 3.63 points higher for participants who expressed concern. In the UK, there was no statistically significant difference between attitude and concern. Both cohorts lacked knowledge of FIP's One Health approach. They lacked an understanding that humans are actually part of this environment. There is an interconnectedness between human health and environmental health, and that things like climate change are a determinant of health. It was really quite interesting. They really described to me as if the environment was some external thing over there. Only 2 of the UK cohort were aware of the NHS Sustainable Development Unit and its purpose. Several just told me that they didn't want to learn about it, that they could not see the relevance to their clinical practice. Pharmacists in both cohorts said that, not everybody, of course, but some did say that pharmaceutical waste is not my responsibility. My role is clinical. And this, of course, is not concordant with FIP's Basel statements or green pharmacy practice. And sadly, the majority, and I did conduct bin audits, the majority of recyclable packaging waste was disposed of in landfill. I also asked the UK pharmacists a series of questions relating to the Sustainable Development Unit, and then what could they do, or what did they feel might be barriers to pharmacists implementing sustainability principles in their clinical practice up on the wards. And these were the 3 key barriers that the pharmacists identified: a lack of awareness of the environmental risk profiles for various drug treatment options, lack of quality environmental evidence incorporated into clinical guidelines upon which to base clinical decisions, and a lack of time to go away and research for themselves on drug treatment options with the lowest environmental risk profile. So that publication, the more detailed findings, I've put the citation there. It's +1, so it's a free download for anyone who's interested. So I've just put up some concluding remarks because I've been researching in this space for well over a decade, and something that really has come across to me is the lack of environmental knowledge. Now, I'm totally aware that I'm preaching to the converted here, so bear with me, but points for reflection is our job is pharmaceuticals. And pharmaceuticals have a significant negative impact on the environment. And the three major impacts are due to the chemical effects of the APIs themselves. It was in my research, I found that pharmacists and technicians weren't aware that wastewater and sewage treatment plants do not remove active pharmaceutical ingredients, and that microbiota in their solid sludge phase often reconverts inactive metabolites back to active. Pharmaceuticals have an extremely large carbon footprint, which is embedded in the manufacture, distribution and consumption. And then also we have pharmaceutical waste. There's the greenhouse gas emissions from the incineration of unwanted pharmaceuticals, and then the inappropriate disposal of packaging waste in landfill. And so I would urge everyone, and I'm aware that I'm preaching to the converted here, but it's all of our responsibility to reduce the carbon footprint of pharmaceutical care. And if anyone is interested in more detailed information on the impact of pharmaceuticals on the environment, I've put a paper down below there. So points for reflection, Catherine's already alluded to FIP. FIP produced an excellent document, Green Pharmacy Practice, in 2015. 2016, they actually brought out a statement of policy called the Environmentally Sustainable Pharmacy Practice, Green Pharmacy. And 2021, the FIP development goals, and goal 21 was sustainability in pharmacy. So from the AMI consensus statement, these are a list of personal values that we believe that health professionals need to achieve United Nations 2030 Sustainable Development Goals. Live in harmony with nature, respect human rights and dignity, respect equity and social justice, take responsibility for ethical resource use, challenge social inequities and misuse of power, and accept that it is your professional duty to protect health. Environmentally responsible behaviours are all of our responsibility. And that's our details. Thank you very much from me. And on behalf of Grace and Catherine, thank you very, very much for inviting us to speak at your conference. The presenters and the information, it's been amazing. Thank you.
Thank you so much. That was so informative. I've taken a few notes down. I think I might have to chat with you guys separately on how we can collaborate and pick your brains and what you've done so far. So amazing. A couple of questions that you might want to answer in the chat box. I picked out one in particular. It was saying about, I think it's more for Grace, learning points from establishing local recycling projects. I think a couple of us here have hit a few brick walls when we're trying to, in terms of segregate waste and kind of get things recycled and set up recycling projects. How did you find it when you set it up?
Thanks, Mina, and thanks for the question. I think it was Tracy, wasn't it? I think the question might have been. I guess for this presentation, you know, I covered all the good bits, yeah. But in terms of the barriers and the challenges, you know, we don't see what happens underneath often. And certainly there were a lot of challenges and barriers to implementing anything new. Don't deny that. Some things that I think I've learned over time, maybe not specific to recycling streams, but just generally speaking, the importance of engaging with the stakeholders. And by that, I think about my fellow colleagues throughout the whole local hospital network, but also the people who it might affect. For example, in one scenario, it did affect the cleaner that came to collect our waste products. How does she feel about this? And does she understand why we're doing it? There was a little bit of perhaps uncertainty from her end about why do I need to do this extra step? So I think really being clear, making a list of who are the people going to be affected, and go and talk to them, because often these.
Sorry, Grace. No.
Yep.
I was just going to say, I can speak to that because that was actually part of my PhD research, and I've talked to Grace about this. In dispensaries, like you've got the outpatient dispensing area and the inpatient. You can tell I'm an old hospital pharmacist, and I noticed the bins weren't right. And part of the issue was the bins that the hospital provided were too tall to go under the dispensing bench. In the end, the pharmacist in charge of this hospital where I was doing my research, like Grace, he went out and bought smaller bins himself. He got sick of asking, so he went out and he bought coloured bins, and then he got stickers made to tell the staff what the three, so that you could recycle it at the source, and that's how he did it. That's happened in one of the NHS trusts. I think it was Sheffield or Leeds, where there were green champions in that hospital department, but they had to get their own recycling bins in the dispensary, and then educate people. And it takes a while, but as like Grace just did things off her own bat. And that was what I found when I researched, that people were just going out and little things like buying bins that actually fitted under the dispensary bench.
Lovely. Okay. Oh, thank you so much again for coming on and sharing your expertise with us today.